What is palindromic rheumatism, and how is it related to RA? Imagine experiencing sudden, intense joint pain that comes and goes like a flash of lightning. That's what happens with palindromic rheumatism, a rare autoimmune condition. It causes quick episodes of joint swelling, redness, and inflammation, usually lasting from a few hours to several days. These attacks often hit small joints like those in the hands, wrists, or knees, and sometimes 2 or 3 joints at once. Between these episodes, the joints look and feel completely normal, with no lasting damage. The exact cause of palindromic rheumatism isn't fully understood, but doctors think it might be related to immune system irregularities or allergies. What makes palindromic rheumatism different from rheumatoid arthritis is mainly its episodic nature. Rheumatoid arthritis is a long-term disease that causes ongoing joint inflammation, which can lead to permanent joint damage and disability over time. In contrast, palindromic rheumatism attacks come and go, and the joints don't sustain lasting harm during these episodes. Despite this difference, they share many features, like joint swelling and immune system involvement, which is why they are considered related conditions within the spectrum of autoimmune arthritis. The connection between palindromic rheumatism and rheumatoid arthritis is quite important. Studies show that about 1/3 to half of people diagnosed with palindromic rheumatism may eventually develop rheumatoid arthritis. This suggests that palindromic rheumatism could be an early or incomplete form of rheumatoid arthritis in some cases. Laboratory tests often reveal markers like rheumatoid factor and anti-citrullinated protein antibodies in both conditions, indicating immune system activity. Because of this overlap, doctors sometimes see palindromic rheumatism as a warning sign or risk factor for developing full-blown rheumatoid arthritis later on. Diagnosing palindromic rheumatism can be tricky because there's no single test that confirms it. Doctors relying on a detailed history of recurrent joint attacks, physical exams during episodes, and tests to rule out other conditions like rheumatoid arthritis. Imaging scans and blood tests may be normal between attacks, which adds to the challenge. Treatment aims to control the sudden attacks with non-steroidal anti-inflammatory drugs, which help reduce pain and swelling. To lower the chances of future episodes and possibly prevent progression, doctors may prescribe disease-modifying drugs similar to those used in rheumatoid arthritis, like hydroxychloroquine or sulfasalazine. Starting treatment early can be helpful in reducing the risk of developing persistent rheumatoid arthritis. In summary, palindromic rheumatism is a condition characterized by episodic joint inflammation that appears and disappears without causing lasting damage. It is closely related to rheumatoid arthritis and may serve as an early warning sign. Recognizing and managing palindromic rheumatism early can be important in preventing or delaying the development of chronic rheumatoid arthritis. If you experience sudden joint pain that comes and goes, it's essential to consult a healthcare professional for proper diagnosis and personalized treatment options.